In this module, we will learn how to help our patient to prevent a lapse or a relapse, and how to manage a lapse or relapse if it occurs despite taking adequate precautions. What is a lapse and relapse? A lapse is when a patient starts drinking again after a period of planned, complete stopping, or when a patient who has been in control of his drinking starts drinking a larger amount and or more frequently than specified in his control drinking plan. When a patient has a lapse, if he stops drinking or controls his drinking again quite speedily, then the lapse remains as a lapse. But if he continues to drink in this way, then his lapse turns into a relapse. Thus, a relapse is not just one occasion like a lapse, but a series of occasions where patient has not kept to his plan of not drinking or controlled drinking. We need to try to help our patients so that they do not lapse in the first place. But we also need to help them so that if they do lapse, they do not turn that lapse into a relapse. To do this, along with the patient, we have to identify potential triggers such as situations or feelings that could lead to drinking. We then help the patient to devise a plan to prevent exposure to these triggers. And despite this, if the patient gets exposed to the triggers, the patient needs to know how to cope with these triggers differently. Another set of potential risk factors for lapse or relapse are the seemingly irrelevant decisions. These are those decisions which appear unimportant on the surface but actually increase the likelihood that the patient will be placed in a high risk situation that can cause a lapse or a relapse. Many times, one apparently irrelevant decision can lead to a chain of other apparently irrelevant decisions. First, we need to help our patients see and recognize these apparently irrelevant decisions which put them into a high risk situation and learn how to avoid these high risk situations. Second, our patients need to understand that avoidance does not always work, and sometimes they will find themselves in high risk situations. So, we need to help them develop the best coping responses, either by practicing drink refusal skills or working on managing the emotions, problem solving, or dealing with their drinking urges. Finally, we need to help our patients to learn what to do in a relapse. Although the patient might feel confident that he is not going to go back to the earlier drinking patterns, it is common to relapse, and the patient needs to understand this. We need to be supportive and try to get the patient to come to see us as soon as possible when they relapse. When we meet the patient, we need to get the specific details of the relapse and how it happened. We need to clarify each step that the patient could have done differently when he relapsed. And finally, we need to rehearse with the patient how he would respond differently if similar situations arise again.